As schools reopen during the COVID-19 pandemic, there are plans to test asymptomatic students in high schools, and parents are concerned about how often such testing will take place and whether they can refuse. Toronto's Associate Medical Officer of Health says there are still many questions surrounding such surveillance testing and gave us some insight about how it might work.
We too have questions on how this is going to work. What we understand is this is what we call surveillance testing. That's our medical term for it. It means testing people not because you think that they have COVID, but just to get an understanding how many people could be asymptomatic and have the illness. And so we understand that in high schools, they will be coming to do the tests. Most high school students will be able to provide informed consent on their own. They would be able to understand the reason for the test, to be able to consent to the test and do it. There is no age of consent in Ontario. And so, classically, usually around 14, you're able to understand the benefits and risks and make a decision. So I would have that conversation with your child. If you don't want your child tested, to make it clear to your child why you don't want them tested so they can provide that informed consent. I don't know what the model is going to look like, though. Whether they'll actually step foot in the high school or whether they'll have a mobile testing unit outside the high school. But the goal is to test high school students more often with this surveillance type testing. The idea is to find out in high schools, how many people are testing positive, what is the asymptomatic rate, so that we can first of all get on top of it to put control measures in place, but also to understand how much COVID is in the community. And it doesn't mean that it's the same students who will be tested all the time. Right. It could be that we're seeing a certain neighborhood in the city that has higher rates of COVID and a few cases related to a school. Well, we may decide that those high schools are ones that are worth doing this testing on. Those kind of strategies may be put in place. And so we're expecting more details, and parents too will hear more about this as well.
In this week's Q&A session, Dr. Vanita Dubey addressed many more back-to-school concerns, and you can find the full chat on our websites citynews.ca and 680news.com. Point your phone camera to the code on the screen you see right now, and a link will pop up to take you directly to that article. For City News, I'm Dilshad Burman.